I'm here to follow up on progress that has been made. So I'm going to go in and talk to Professor Margaret Kobia, the Cabinet Secretary in the Ministry of Public Service and Gender, to ask on what progress has been made on gender equality. The government of Kenya made a commitment to the PMNCH call to action on COVID. So I'm just here to follow up on progress.
Kenya has made progress towards gender equality. The progress has not been as we would have wanted it to be in terms of, because of the setting in of COVID-19, we have seen a setback on the speed of gender equality. Let me say that Kenya government has been working around 4 themes regarding gender equality and women empowerment. One, we didn't ask ourselves why aren't we making good progress when it comes to gender equality. And as we committed ourselves last year to promote gender equality, not just for the purpose of promoting gender equality, but as a strategy for securing health and well-being of our women and children. We do believe strongly that when you empower women, they are able to uplift them to be able to access equal opportunities. So when you empower women, they are able to lift themselves, they are able to lift everybody else, and by so doing, we remove poverty and we enjoy a better quality of life in Kenya, and I'm sure in the globe. So Kenya government, and particularly this Ministry of Public Service and Gender, we have been focusing on 4 thematic areas as far as gender equality is concerned. One, we are trying to empower women in leadership and decision making. 2, we are also trying to empower women through socioeconomic activities. We are also dealing with 3 matters of gender-based violence. And 4, we are looking at women and girls, peace and security. So regarding women leadership, we in Kenya, we have done very well in executive, where we have achieved that % representation of women. Also in judiciary, where we have also attained about 42% representation of the genders. Where we are struggling is in legislative, especially parliament, in particular parliament, where we do not have a third of either gender represented in parliament. In fact, we have closely to 20% or 23%. Therefore, we as a government, we have been working around how do we empower women to be able to go for elective position. And since we last had the interview with you and the conversation regarding gender equality, we have been able to develop a curriculum that answers the questions, what are the barriers to women who want to go to elective position. And we have realized that some of the barriers that they experience related to having resources to be able to do the campaigns. It has also to do with the confidence and the competency to be able to come up and offer oneself to go for elective position. We have also realized that women will not go for elective position if they perceive there is violence. So what we did, we came up with a curriculum developed through Kenya School of Government, also ENA organization we supported, and the ministry. And once we came up with the curriculum for training women who want to go for elective position, we also went ahead and did the training. Now, right now, we have about 86 women who have been trained from representing the 47 counties, so that in case they want to go for elective position, they know they have the knowledge, they have the skills and competencies of how they should go about this. We also linked them up with the mentors so that they can be able to find a resource that supports them as they go towards preparing themselves to go for elective position. You may ask then, why do we want women in parliament? We want women in parliament because that is where major decisions are made. major decisions to do with the budget. You remember last time we said we have failed to actualize or to achieve the commitment we have made towards gender equality because of lack of funding. And the last time we said we are going to look for about 112 million US dollars to support a program for women and gender equality. Therefore, if women were sitting in the parliament, I believe they would make decisions that support women agenda in terms of the budget. I'm sure they would support any effort towards water, because a lot of women who live in the rural areas struggle getting water for themselves. They would support the budget that would support education, and I'm sure they would also support huge budget that would support health for women and girls, and even for the entire society. So it is very key that we move from the less than 20% of the women in parliament now to make it almost 30 as the constitution dictates, or even with the time, why can't we have representation in the parliament being 50-50? Because this is where they provide oversight, they do the laws that we need, because and also they provide oversight. So if women's voice is heard in the parliament, I'm sure you would make great strides regarding moving to an equal gender society. The other area that we work around is to empower women economically, and what the Kenyan government has done is to have an affirmative fund, which is giving women in small businesses to the tune of about 5 million US dollars every month, so that they can be able to support their small businesses. They will be economically empowered. They will be able to make decisions regarding how they take their children to school, how to feed their children so that they have better health, nutrition, and also they will have a voice. You know, poverty wears the women's face. So if we give them affirmative funds so that they are able to go into business, or they are able to help themselves to no matter how small the business is, or even to be able to engage with other people in business, including traveling from one country to another to see examples where business have worked, it would be a huge way of supporting women empowerment. So economic empowerment actually, in my view, is very central to making women get a voice. Another area we are working on is on gender-based violence. We have come to recognize that with the coming in of COVID-19 pandemic, different male and female have different experiences. But we also realize there's more pressure on women and girls as a result of pandemic. You may realize that most of the health workers are women, almost 70%. Therefore, they are in the forefront. And because of the COVID-19 pandemic, they have to work long hours. So what the government has done is to find a way of easing their long hours by employing a few more health workers. That it did take place. And also, we also realized that the whole area of women experiencing violence is more pronounced during the COVID-19. We have found, because of this confinement at home during the lockdown, most of the women are now long working hours at the workplace as health workers. They also are long working hours at home because their children and families are home. So those family chores increased. So women can easily get a setback and be bogged down by unpaid care work that they have to give during this COVID time. We also realized that women were experiencing non-representation in senior position in the health sector. Much as you hear 70% of health workers are women, in Kenya, 15%, it's about 15% that is presented at decision making. So we have an argument that if there are so many women in health sectors, medical workers, why aren't we seeing them also senior in the health sector so that they can help make a decision? So what we did is we didn't approach the government, especially when we were making National Emergency Corona Response Committee, so that we, in the task force, we had, they had no women to start with in the beginning, but with our intervention from the State Department of Gender, we had about 3 women representing. And I think that brought a lot of positive input, because as we are designing the PPEs, as they were thinking about how to support women or population or communities that live in the slum, then the input of women became very handy. So I think we need to watch out where we need women's voice as far as decisions are being made. So with that, regarding also gender-based violence, which you have seen is it has increased from by 36% gender-based violence through helpline toll-free, which the government runs, 1195. We have seen gender-based violence cases increasing by 36%. Therefore, to be able to confront that, the government actually conducted a study. We did involve National Research Crime Center to find what are the causes of increased gender-based violence, especially during this time of COVID. And it was found out being confined at home was one of the causes. Poverty was another cause. Also alcohol and drug abuse. So using this data and the findings from the research study, then the government was able to design some of the intervention. And some of the intervention involved cash transfers for the purpose of making sure that those who are very vulnerable women, the household was getting like $200 per month to be able to go to the shops and buy food. So that's an intervention that was informed by evidence from the study. We also gave some of the work to the youth, which we call Kazi Mtaani, just for the youth to be able to generate a little income. And of course, we also worked together with other ministries, for ministries like Public Service, Ministry of Interior, Education, Health, and Labor, because we have found the whole area of gender-based violence is complex, and the effort cannot be from just one department of government, but working with the government department, development partners, NGOs, we have been able to put a plan of how to address gender-based violence. And this is where it involves being able to give civic education, how women and girls should be able to detect early warnings. They should also be able to report, including using their mobile phone app to report incidences where they realize they are at the danger or they're exposed by gender-based violence. We have also come up with the rescue centers where people who have experienced gender-based violence can be in a center for a certain period while they are seeking medical services. They are also seeking legal help. They are also getting some counseling. So what I'm trying to say is with the COVID-19 pandemic, we have seen increased cases of gender-based violence, but trying to have an intervention so that we don't have gender equality setback is the right decision to take. And of course, working with the partners across government, across society, it holds a promise for overcoming gender-based violence. We also have a child line, 116, because we have also realized there's a bit of, during this period, child neglect. We have also child defilement. We have also child abuse. So we have also line 116 that children can be assisted, direct for children. And the other line, 1195, is also the one for gender-based violence. This is the line that is giving us data how many cases are reported per day, per week, per month. The final area that we are working on has to do with women in peace and security. During also this time of pandemic, we have realized quite a number of women are vulnerable. With the lockdown, with the curfew, sometimes women would find difficulty to reach their home if they are late. And also we also realized last time when we had the interview, the government was already constructing several water points in the slum areas and also increasing lighting. So that project has continued so that there's well-lit areas where girls and women can be able to access services even if it gets dark. So I think we have seen some progress, but also some setback because of COVID-19 pandemic. However, I do believe gender equality for the purpose of improving the quality of life for Kenyans, I think is not something new, because that's why we have also Sustainable Development Goal number 5 that still focuses on gender equality and women empowerment globally. So working with the Partnership for Maternal, Newborn and Child Health, I think where they support women, children and adolescents is very key to supporting also gender equality. It's like they complement each other. You cannot get gender equality if you don't have better health for both children and women. And if we get the gender equality right, then the women will be empowered to take care of their health, to take care of their newborn, and also to give information to adolescents. Let me also point out during the pandemic, we didn't realize quite a number of people, women were afraid to go to hospitals because there was the whole kind of information that the hospitals is where you are likely to contract COVID-19. So you have seen women give birth at home. That is an area of concern to government because, you know, if that happens, it's a danger to the mother and the newborn. We have also seen during this time of COVID, the health workers overstretched, and they might not give the necessary attention to hospitals the way they would because they are working long hours, and that is also an area where government has been finding intervention by hiring more people, giving information so that people they know you can go to hospital even during the time of COVID and still not get COVID. We have also seen the security sector, because they are also out there enforcing the law. Then you can also even see women who are experiencing gender-based violence. They might go to police station and not find the personnel because the personnel has gone for another errand regarding providing services on the curfew, on being able to attend to other increased services. So we must accept that with the coming of the COVID, we must rethink what the plans we are going to put in place so that we don't experience a major setback on gender equality. And as I said, gender equality does not just stand for gender equality itself. It has a bigger purpose. A bigger purpose for moving towards gender equality is to have a better quality of life. Therefore, we must take note that women and girls experience different kind of effect and impact negatively as compared to men. Therefore, we must have different intervention for different challenge, but at the same time, we should just work towards having an equal world where both women and men, girls and boys, have an opportunity to exploit, to reach their full potential. So I think that's what we have done, and I think we will continue lobbying for funds to support women, girls, and adolescents, and at the same time keep on taking stock how we are working within the whole of government, working with the whole of society, with the civil society, and working with the development partner to ensure that the momentum for gender equality is maintained moving forward. In Kenya, we have about 36 rescue centers that cater for victims of gender-based violence. These 36 centers are privately owned. The government, national government and the county government, we have about 5 centers that are developed by women members of parliament. So we have a total of about 41 rescue centers spread around the country. We feel the idea of having rescue centers where victims of gender-based violence can go to seek help is very important. But at the same time, we also know that not every victim wants to go to a rescue center. And one of the reasons we have been given is some of the people in a family, like a wife who has been abused by her husband or assaulted, doesn't want to leave their children with the victim to go to the rescue center. So that one may require a different intervention. But those who are able to go to rescue centers, they are able to get services like counseling. They are able to be assisted with information where they can be able to take their matter. And in this case, they will likely to find somebody from judiciary. They will find someone from national government, an administrator who will give them information. They will also be able to give somebody who will give health kind of support. So rescue centers are made in a way that they are situated near other amenities like health, the police, so that when you go to the rescue center, you are able to get that kind of support. Some might stay there for a week, others for a month, and while they are there, then rescue centers have been having programs. What do you do with these victims of gender-based violence while they are there? There are those when they get the services maybe within the first week, and is supported to go to hospital. Sometimes they are given some support to pay for those health services, and also a place to stay to have your meals. But some who stay longer, sometimes even with their own children, they are supported just to find a solution of what should they do in their life. Some of the rescue centers have also been able to give them a skill, like to go in small businesses, to do a bit of tailoring, and we have found there are also most of these rescue centers are also supported by people who are philanthropic, and also those people who just would want to support because maybe of they have been appealed to. Because one of the things we also recognize in the rescue centers, they struggle with the funding, and the government have been able to support the 5. The other 36 are more or less supported by private sector and other individuals who are kind of doing kind of voluntary work. You did ask that are these rescue centers friendly to all? That means women, youth, and children. That is one we in the Ministry of Gender, we have come up with guidelines how to run those rescue centers. And one of the areas is to make sure that they have a structure of how one reports, what kind of information they are given, and then they give those reports to gender officer within their county. So the idea is to attract everybody. Whoever is a victim of gender-based violence should find one of the places they could get help is at the rescue center if it is near you. And others are referred from the police station. They go and report their case of assault, and then they are referred to a rescue center, or the vice versa. They could also go to the rescue center and they are referred to the police desk, who we have been working very, very closely with. In every police station, there is a gender desk. This gender desk gives information to the victim where they can report, and they're feeling secure enough. And since the whole issue of gender-based violence is also stigmatized, and the people don't want to experience that stigma as they are reporting their matter at the front office of a police station. So we have gender desk where victim report and then they get the necessary support, which might include going to hospital, might include going to court. So you find you need quite a number of people to be able to support these victims of gender-based violence. We have seen most of the people who frequent gender-based violence they are even those girls who get pregnant and maybe they are having difficulties being accommodated in their homes. Some of them go to gender-based violence rescue. We call them rescue centers. So young girls who become pregnant at an early stage, they go to those gender-based violence. Another category that goes there is those girls who are running away from female genital mutilation. They find it very useful to go and be there while they are escaping from their families or communities. Another category that uses the rescue center also has to do with even a few men. Yeah, a few men who need that kind, who are very few, like maybe less than 10%. They also use the rescue center. So the idea of a rescue center is progressive, but also it is not the only one. I think I think most of the young girls are in those two categories of teenage pregnancies and those who are running away from child kind of abuse and especially FGM. Yeah. Regarding funding that is given for economic empowerment, I think they are in two categories. One, there are these women who come into groups and they form a group and then they apply for a government affirmative fund to be able to support themselves and their businesses. That is open to everyone and it has a structure. The information is on the website. What we call Women Enterprise Fund, Youth Enterprise Fund, USO Enterprise Fund, they have gone out there to give this information that anybody who requires to be funded requires to be in a group, and then they will be registered group, and then now they can be able to access the funding. The amount of money that each one of the group member accesses depending on the level of their business. Those who are starting, there are those who are in the middle level, there are those who have grown. So Women Enterprise Fund or WEF and youth, they will be able to access. So that is one category. The other category, the one I talked about, that is the one which gets about 5 million USD every month, even today. But there is also what we call Kazi Mutaani. This is for the youth during this time of COVID. The government designed a program where in every county, through the county commissioner, they can go and get some work, which they work every day, and they earn something like $50, which is actually quite reasonable, $50 in Kenya standard per day. And there are quite a number, almost 30,000 youth who are benefiting from that category. I also talked about another category of the most vulnerable living in the slum, those who are getting cash transfers, who are getting to the tune of $200 every month. So it is categorized on need-based, and I think it has gone a long way to alleviate the suffering during this time of COVID, especially to help themselves with the food security, health issues, and I think the government would want to continue supporting them until maybe such a time that we are able to have everybody vaccinated, have everybody now maybe overcome COVID, but those are some of the funding that the government has put in place. Remember, it is never enough, but it's better to support those who are vulnerable, and we have said women and girls are very vulnerable during this time of hardships. Maybe the other area that I would have wanted to mention is how has the government supported health workers, female health workers. We remember immediately they started working for long hours, the government came up with an allowance to help them, a medical allowance that could help them because they are working very long hours. They also never had, The insurance scheme, that medical insurance scheme that we had in government did not cover cases like COVID-19 because it's more or less like a crisis. Yeah. So the government designed a medical cover that would also cover all health workers during the time of COVID. So that is very much in place. We have also realized that a lot of health workers were struggling with the mental issues because I think due to various reasons, maybe long working hours, maybe home environment, a lot of health workers, especially women, were suffering from mental issues. So the government came together and they put a unit of psychological counseling that now, and they also sensitized some of the medical workers. How do you know if you are getting depressed? So that support, psychological support, the government did put a unit which is working with health sector, Ministry of Health, to make sure that medical staff are supported during this COVID pandemic. I don't think this is going to stop. Even after the COVID, I think we have also realized that mental health is very critical to support women and girls so that they can even be able to look after their families and their children. So I think those have been some of the areas that the government has gone way out to be able to support the health workers. The Ministry of Gender is very happy to work with the youth, and it's always important when we have planned on the interventions of promotion of gender equality, that we also listen to the youth. And as we make progress, we also learn new perspective. So if the youth has come together to think, to map out where are we and what is the next roadmap, my ministry is very keen to get that feedback so that we can put in the front of gender sector working group to get the perspective of the youth. Because unless you cannot decide for the youth unless the youth decides for themselves. The same we are saying, decisions that affect women, decisions that affect girls cannot be made if they are not at the table. Yes. So anytime, and this is a journey. It's not something that we think will deal with all interventions in 1 or 2 years and finish. Yes. It's a journey that we are committed to take to promote gender equality and women empowerment. And the youth voice is very, very important because first you become a girl, then before you become a woman. So I think starting early, and we now know most of the women in leadership, they started when they were youth. I've not seen a woman who becomes a leader when she gets 50. They started at the age of teenage. They were leading in their class. They were leading in community events. They were also leading in the university. So starting early holds the promise of how many leaders we can have to have a kind of leadership position politically, maybe in parliament, in executive, in judiciary. And I think we have done it very well. For the very first time, as you are interviewing me now here, a woman has been nominated to become a Chief Justice of Republic of Kenya for the very, very first time. This is Lady Justice Martha Koome. So it is a journey with some rewards, we can see it, but it's also not an easy journey. It's a journey that requires commitment from all quarters. Yeah, thank you very much.